Biggest lie you ever heard about penis health?
I'll pass this.
Do boxers versus brief, like what do you suggest? Like
The study was there, but the evidence was not there. If people are going for gym where they are lifting heavy, then yes, a brief, or I would say a scrotal supporter or a jock strap is something which should be used.
Viagra. Taking Viagra, somebody is like dying.
So basically, there's a very interesting story about how Viagra was invented.
Does size really matter?
So basically, see, every man sizes, and actually the study was conducted where the women have to report about the men's sizes because every man feel that his size is less.
मतलब आपने शीलाजीत खाया तो मतलब आपको सही में कोई दिक्कत है. How does it work? Does it really work? Does science support it? Because it's Ayurvedic.
See, Shilajit has been touted as a testosterone booster.
Thinks has a ED because the person has googled it, of course. Thinks he has an ED, right?
So basically, there are two type of EDs. One is a psychogenic ED, and another is an organic.
Jai Hind everyone, my name is Ankur. I'm your host from the C-Suit Club. Today we have Dr. Ashish Saini. He's a very renowned andrologist and urologist. Plus, he's also a gold medalist from AIMS. He comes with about 21 years of experience in surgery, and he has done about 21,000 plus surgery in both andrology and urology field. So, welcome Dr. Ashish Saini.
Thank you, Ankur, for having me here, and I'm glad to be here on this podcast.
So, the reason we are having this podcast today, Dr. Ashish Saini, is that June is the month for men's health. And one of the major conversation I had with a lot of my friends was about erectile dysfunction, sex, something around, how do you call it in English? I don't know. But in Hindi, it's called Shighra Patan. So I don't know what it's called.
Premature ejaculation.
Premature ejaculation, correct. So this is something which is very common now these days. So before we jump on to all this extremely taboo, which is now being considered even in 2025, these questions, I would like to first, our viewers would like to know first about your journey, who you are as a person, and what do you do apart from being practicing a medicine?
I hail from Saharanpur. It's a small town in Uttar Pradesh. I did my medical education from King George Medical College, Lucknow. And then I did my MCH, which is a super specialization in urology from AIMS. And then I was a faculty in AIMS for 5 years. And then I switched over to a private practice, and now I have my own center, which caters to urology and andrology, known as Excel Advanced Urology Center in Greater Kailash, Part 1. Apart from my academic and other activities of urology, I'm a sports person. I started as a cyclist, so I'm an ultra cyclist, a marathoner, and now an Ironman. So this is how we mix up our time and make more of like a balanced. As you take a balanced diet, you have a balanced approach towards your life.
You really show people like what doctor advises to stay fit. You actually leads it with an example by doing it as well. What is an ultra cyclist like? I mean,
see, if you are cycling for more than 400 kilometers, then you come into the category of ultra cycling. So
400 non-stop.
Yeah, you can take breaks. There is a defined time to complete it. So I was the first urologist in the world to complete the Paris-Brest Paris. So basically, it's a longest ultra cycling event, the oldest one in the world, where you have to cycle 1200 kilometers with 11,500 meters of elevation. So you are actually climbing Mount Everest 1.5 times.
Oh, wow.
And you have to do everything in 90 hours. In between, there are pit stops where you take rest, you take some food. If you can sleep, you can have few naps. But then you have to complete it in that defined time.
Okay, so that's ultra cyclist. Ironman, I know it's about, that includes running, swimming, and full marathon.
So when one sport is not enough, you become a triathlete. It's basically more of a midlife crisis thing where people, when they feel that they are in their 40s, they want to do something about their health. So they do cycling, swimming, running all together.
That brings me to a question, honestly. I used to cycle when I was young only to gain height. सिर्फ height लंबी करने के लिए घर वाले बोलते हैं cycle चलाओ आपकी height लंबी हो जाएगी. But then I read somewhere while doing a cycling, it can affect your testicles or it affects you somewhere in your private parts. Is it true?
See, it depends upon the. It's not true. Partly true. Basically, when you are doing any endurance sport like cycling, one is something for sports, for fun. If you are going for like 20 kilometers, it doesn't matter. Nothing is going to happen to you. Second is that if you are doing ultra cycling, then in that case, you need to have a bike fit. The bike fit has to be done where the saddle height and everything is adjusted. You wear bib shorts which are actually, so there are different type of bib shorts which have a padding depending upon the kilometers which you are. So there is a lot of science into it. There were certain studies which say that it may lead to some amount of numbness, but usually majority of the studies they say that it doesn't hamper your erections. Rather, you can have better erections because now your pelvic floor as well as the muscles which are supporting are better developed in a cyclist. So basically, it's more of an endurance game, and you actually have gains in the long run.
Right. So, okay, now I just said testicle as a word very openly out here, but you know, it is very difficult for any man, rather, any man in the world, to basically walk into a urologist clinic and speak about it. So, why this do you feel is still a taboo? We are sitting in 2025 already.
See, what I have realized is that the times are changing. It was, but because of the social media and a lot of campaigns being run, now people are coming up. But still, what happens is that usually we do not have a medical reason. The first thing which you have is a Google. So whenever you have something, the first thing which you are doing to do is you will ask the Google Baba, ki what has happened to me? And usually there is some hint that you may have a cancer. So it is basically a scary event where a person Googles anything and the cancer words pops up. And therefore your query increases, and basically it's more of something like a fear mongering thing where you are more fearful and therefore you are going to read more, you are going to scan more. So coming to your question, that it's still a taboo because of the fact that people do not know about their genitals. Nobody has talked to them about sex education or your physical education in their primary schools, which is very important. So therefore, there is a lot of misconception. He may have the first encounter of the genitals on seeing a pornographic film or a blue film or from his friends, and therefore there is always some amount of shyness. There is an inhibition where they are not able to talk about it. So that is what we are talking, that we, in this podcast, I think it is about ki baat to karo.
Correct.
So basically we need to come out of that, and then there is always help available.
So you said Google. I completely agree with you, Dr. Ashish, because as anyone, even I have done that. I have Googled my illness and it has led to cancer. And it's like, okay, this is the end. जीवन खत्म हो जाएगा अब इसके बाद ही, ठीक है. मतलब गूगल एक्चुअली सारे जवाब तुम्हें कैंसर पे ला के रोक देता है कि ये हुआ तो ये हुआ तो ये हुआ, ये नहीं हुआ तो अगर सब कुछ होगा तो कैंसर हो जाएगा आपको. आई कम्प्लीटली एग्री. नाउ हैविंग सेड दैट, आई एम श्योर 21 साल का एक्सपीरियंस और 21,000 सर्जरीज के बीच में यू हैड पेशेंट जिन्होंने सर्जरी कराई भी नहीं हुई किसी डर के मारे. मुझे आप ये बताइए कि एक इंसान ने गूगल करा है हाइपोथेटिकली, वैसे 98%, 90% आई एम श्योर लोग गूगल करके सबसे पहले करते हैं, उसके पहले खुद डॉक्टर बनते हैं, फिर डॉक्टर के पास जाते हैं. तो किसी इंसान ने गूगल करा है, गूगल करके उसको समझ में आया कि भाई उसको ऐसी बीमारी हो सकती है या हो गई है, होने वाली है, दोनों में से कोई एक संभावना है. एंड देन द गाय रीचेज आउट टू यू. कैन यू टेल अस समथिंग अबाउट दैट?
सो बहुत कॉमनली मैंने देखा कि किसी ने अपने टेस्टिस को पहली बार पैल्पेट किया, बॉल्स को, और उसको लगा कि वहाँ पे कोई लंप या गांठ हो गई है, एंड उसको उसने गूगल किया, एंड एनी मास और लंप इन द टेस्टिस इज़ कैंसर अंटिल प्रूवन अदरवाइज. तो कई सारे पेशेंट ऐसे मेरे पास आते हैं, स्पेशली यंग बॉयज़ अराउंड 17-18, या दे आर जस्ट हिटिंग प्यूबर्टी.
ओके.
दे हैव टच देयर टेस्टिकल्स फॉर द फर्स्ट टाइम एंड दे फील कि लंप है, एंड द ओनली थिंग इज़ in their mind is कि मुझे कोई कैंसर तो नहीं हो गया. We examine them, and to reassure, sometimes we do an ultrasound, so that basically what happens is that on the testes there is a structure known as epididymis, so that feels like a lump, which is a normal thing. But then if you have doubt, see an andrologist, a urologist who is specializing in the part of infertility and erectile dysfunction. And sometimes I've even seen that there was a lump, but the patient, because of the shyness, has come to me after 6 months. In a testicular cancer, if it is there, it will give you the tumor doubling time is just 1 month. So basically, if you have a doubt, clear it out. Because urologists, unlike any other place in the West where they are not available, India, they are available. If you have a problem in the genitals, there has to be an offline appointment. Sometimes I have found that because of an online appointment, the thing has been missed completely. You have said something, the doctor has understood something, but the physical contact was missing and the diagnosis was missed.
तो काफ़ी ज़रूरी है कि a patient should actually walk up to a doctor and talk about it as openly as possible.
Yes.
Okay. You mentioned that the patient came 6 months later after finding out as to what has happened. Now, what would have happened if the patient had come maybe a year later? Same issue. Or maybe a different issue.
See, there is always a stage, if there is a cancer of the balls, the testicular cancer, there is a stage migration. So a cancer which is in stage 1 and 2 is 95% we can cure it. Beyond that, the control is there, not the cure.
You mentioned you get a lot of patients from the age group of 17, 18 people who are just hitting the puberty, 20s, right? Right now, Dr. Ashish, the lifestyle over the last 10 years, 10, 15 years, I feel has changed completely. Like, you are doing triathlon in your 40s. I'm in my 30s, mid 30s right now. I'm okay to go to gym. Max. That is the best I'm doing to keep myself fit, active, so that I don't face any issues in a longer and maybe in my old age. That is my psyche altogether. But off late, people who are reaching out to you for who are 17-year-old or 20-year-old, around in mid-20s altogether, more or less they are called Gen Zs. So you must be getting a lot of Gen Zs in your clinic, right? Now, I want to understand. Now, it's a very elaborative topic I'm going to talk about. So help me understand, just this is the only problem people come to you, or do they actually come for any other issues? I'm talking about this generation, and then I'll switch to 30s and 40s.
Yeah. So basically, because they have experienced erections when they are hitting puberty, they have concern about their penile size. That's the first thing, that my penis size, whether it's okay or not. The second is they have concern about their morning erections. Some people may not have their morning erections and they are concerned about that. And some of them, they basically are just coming for a reassurance that I want you to check my genitals, that whether they are normal or not. So that is also there, and I feel okay about it, because of the fact that at least they are getting that confidence to go to a proper person to get a proper guidance. And that is something which I feel is now changing. So this generation, maybe it's not, they are active more on the social media, but they have figured out somewhat how to come, because as you were saying that people in their 40s, the stigma was more there.
Correct.
Now it is less. The information is more, but it may be a lot of misinformation. So you need to basically, it's like separating the chaff from the wheat. So something like that, which is not possible on the sites. So I think that is changing, and we are getting youngsters who are concerned about their genitals.
Okay. You mentioned about the size. Does size really matter?
So basically, see, every man. So there was a study. There were a lot of men sizes, and actually the study was conducted where the women have to report about the men sizes, because every man feel that his size is less. Nobody will say that I have a longer penis. There will be like 5% or 10% of them. Everybody feel that their sizes are less. So does it actually matters? The study actually gave evidence that the size usually doesn't matter. It's actually playing more in the head of the male rather than the female. There are a lot of things in the sexual act which matters: the bonding, the way it has been conducted, and then the whole act. So basically, it is sex is not just the size, uh, and so there are many things. So basically, it depends upon how long you are lasting, and are you ejaculating early, or is it a normal ejaculation? So these are the things which make up the entire act.
Okay, this premature ejaculation, even I've heard from my female friends as well, as to, somebody met somebody, they ended up doing, they got into an act, and the girl got disappointed. A lot of marriages are failing because of that, right? So this is like one of the major issue now. Now, why is it? Now you said long lasting, and there is a premature ejaculation, right? There is, or maybe there is something in the middle as well.
Yeah.
So now help me understand. Is it true that the fertility is dropping in people in their 20s, 30s, 40s? Or like, I want to understand this whole dynamics altogether about fertility, since you brought up the sex part over here. Mm-hmm. So that also leads to fertility.
Actually, that's a very important question. In India or anywhere across the world, people mix erectile dysfunction with fertility. These are two different aspects altogether. A person may be sexually very active, he may be infertile. The person may be having very good fertility potentials, but he may have erectile dysfunction. So these are two different things. One is an erection, one is an ejaculation. So both these two things have different mechanism, the way they are connected to your body. So when we are talking about the penis size, so basically, if you look at the average penis size, then the average penis size is 5 inches. The second question is what would be the average duration of sexual activity? Not the foreplay, but the intravaginal ejaculatory latency time. So IVELTS is basically how we define the premature ejaculation.
I never thought of it while I had sex with somebody else. It's called like this.
Yeah. So basically, it's an IVELTS. So the intravaginal ejaculatory latency time, if it is less than 2 minutes, then it is premature ejaculation. The average time would be 5 minutes. So basically, this is also, many people have seen blue films, they have seen porns, they have seen people in an act, and they feel that people can go on for hours together. That is not the true case. Usually a 5 minute is what is being studied, and that's the average time.
Okay, understood. So does porn really affects someone's mental health, which leads to a sexual, maybe not mental health. I'm going to rephrase this question. Does porn really affect someone's sexual health? Like, I've heard cases people get addicted to porn and their marriage life gets screwed because of that, or any other issues around that, or they get addicted to masturbation. Can you shed some light over there?
See, yes. So this is what we are seeing commonly. Because of seeing a lot of porn, what happens is that your reflexes become infantile. Infantile means like an infant, like a child. So just to complete the act, the brain gives a signal to ejaculate early. So basically, if you are watching porn and then you are masturbating, masturbation also, because you are using a dry hand rather than a wet vagina which is there. So, and it is under your own control. So therefore, if you are doing a lot of porn masturbation, you will have premature ejaculation if you are addicted to it. What will be a healthy masturbation? The healthy masturbation would be every 4th day. So if you are not masturbating altogether, or if you are masturbating too often, both of them will lead to an erectile dysfunction. So basically, जो एक बहुत वो है ना कि सीमन को संचय करना, तो आप संचय नहीं कर सकते. There is no bank in the body. Your sperm dies after 5 days, and that's the reason when we are doing a semen analysis, when we are basically diagnosing patients with infertility, we ask them, the WHO criteria is that the semen has to be 3 to 5 days. That has to be the gap.
3 to 5 days old in the system.
Yeah, old in the system. So if it is more than 5 days, then it is going to have more of dead sperm. So basically that concept, which has been there by a lot of YouTubers, they say that your entire body protein and everything is going in the semen. That's a big myth. The semen has 70% water only. And basically, we would say every fourth day is okay. Doing it every day or maybe 3 or 4 times a day, especially sometime when you are young, you may do that. Not a healthy way to do it. And we are seeing patients where they lose the interest. They do not have that sensitivity when they are looking at a person, and therefore they may lose the interest altogether.
Okay, you very rightly mentioned YouTubers. I understand a lot of in this new age media, a lot of people are giving gyan about left, right, center everywhere. Now there is one more thing which is very viral on Instagram. मेरे मतलब सभी के ज़मानों में, मेरे ज़माना कोई अलग नहीं था. मेरे स्कूल टाइम पर, मेरे कॉलेज टाइम पर शीलाजीत वर्ड यूज़ करना वाज लाइक पाप. मतलब आपने शीलाजीत खाया तो मतलब आपको सही में कोई दिक्कत है. ठीक है, तो थोड़ा बताइए कि ये जो शीलाजीत मार्केट में आजकल हर कोई प्रोडक्ट लेकर आ रहा है, जैसे कोई सेंटर फ्रेश आ गई हो या फिर कोई टॉफ़ी आ गई हो मार्केट में, आज के डेट में उसका जो प्रचार हो रहा है वो काफ़ी उसका नैरेटिव चेंज कर दिया लोगों ने कि इट्स नॉट अबाउट it helps you with sex, it's testosterone. Now tell me about Shilajit. Like, how does it work? Does it really work? Does science supports it? Because it's Ayurvedic.
See, per se, Shilajit has been touted as a testosterone booster. Since I am into modern medicine, I will not comment on Shilajit per se, how it works and doesn't work. The only question is that whether you should take it or not. Whether the testosterone boosters, natural or unnatural or synthetic, they are helpful to you or not. So basically we have to understand कि टेस्टोस्टेरॉन क्या है. टेस्टोस्टेरॉन एक मेल हार्मोन है जो हमारी बॉडी बना रही है इन रेस्पॉन्स टू द कॉर्टिसोल इन द मॉर्निंग. सो बेसिकली कॉर्टिसोल सिक्रीशन होता है जब आप सुबह उठते हैं. उसके बाद क्या है कि आप समझ लीजिए कि आपने मॉर्निंग उठे, आपने एक्सरसाइज करी. उस एक्सरसाइज करने से जो स्टिमुलेशन आता है तो बॉडी टेस्टोस्टेरोन बनाती है. आपने इंजन की जितना, जैसे आपके इंजन को आपने रेव अप किया, जैसा आप उसमें डालोगे वैसा ही. अब आप मॉर्निंग में आप उठ नहीं रहे हो, लेट उठ रहे हो, लेट नाइट पार्टीज़ के बाद आप उठ रहे हो, तो बॉडी को पता है कि मॉर्निंग में कि भाई अब टेस्टोस्टेरोन की ज़रूरत नहीं है इसको, ये तो सो रहा है अभी भी, तो वो टेस्टोस्टेरोन ड्रॉप हो जाता है. तो हमारे पास जब पेशेंट आता है तो हम ये सवाल पूछते हैं कि भाई लाइफस्टाइल क्या है आपका, कहाँ पे कमियाँ हैं. नेचुरली जो टेस्टोस्टेरोन बूस्ट होता है वो हमारी बॉडी से, अगर हम बाहर से टेस्टोस्टेरोन बूस्टर लेंगे तो जो हमारे अंदर का टेस्टोस्टेरोन बन रहा है वो बनना बंद हो जाएगा. एंड देयरफॉर इट इज़ इम्पॉर्टेंट कि पहले हमें देखना है कि ज़रूरत है कि नहीं है. तो टेस्टोस्टेरोन रिप्लेसमेंट थेरेपी या टेस्टोस्टेरोन स्टिमुलेशन थेरेपी, ये 2 टर्म्स होती हैं जो यूज़ करी जाती हैं. एंड ये हम लेते हैं तभी जब इसकी ज़रूरत हो. बहुत सारे जिम में, रादर बहुत नहीं, मैं कहूँगा कि 95% ऑफ द जिम्स इन अक्रॉस इंडिया, वहाँ पे जो लड़के आते हैं उनको लगता है कि मैं 2 दिन एक्सरसाइज कर लूँ और सलमान खान बन जाऊँ, नहीं तो अक्षय कुमार बन जाऊँ. इट इज़ नॉट पॉसिबल. आप जो भी इंजेक्शंस लगाएंगे, कुछ लोग साइकिल्स पे होते हैं, फिर उसके बाद उसको साइकिल को वॉश ऑफ करते हैं, your entire hormonal axis gets disrupted, and that may lead to infertility because testosterone is a male contraceptive.
I agree, because I started working out, Dr. Ashish, back in my school days. This was long back in 2005, 2006. And I have come across very good bodybuilders and some are very known personalities in the market also. So gym trainer का ना एक business हुआ करता था, अभी भी वही है. एक प्रोटीन बेचना, वेट गेनर बेचना और तेरी बॉडी बना दूंगा इंजेक्शन के साथ. सो बहुत पहले मैंने ये चीज़ समझ ली थी, बिकॉज सिंस आई वॉज वर्किंग आउट, आई वॉज वे टू यंग. सब बच्चा समझा करते थे उस समय पर, क्योंकि सारे मेरे से बड़े थे पूरे जिम में. तो एक बंदे ने मुझे बात बोल दी, कुछ भी हो जाए ये मत लेना, नेचुरल तेरी बॉडी ग्रो होना हो. एंड आई हैव सीन पीपल इन द जिम हु हैव टेकन इट, इधर दे हैव लॉस्ट हेयर, आई विजन कम हो गई है उनकी, और इट हैज़ अफेक्टेड देयर प्राइवेट पार्ट्स. नाउ let's say this has happened, somebody took it, they wanted to become an Arnold Schwarzenegger, ban gaye. Ab how to solve ED, because ED becomes erectile dysfunction becomes a manhood issue across the globe, forget India. मतलब अगर कोई लड़की ये बात बोल दे कि इस लड़के को कि भैया तुम्हारा परफॉर्मेंस अच्छा नहीं है, या फिर you're not hard enough to get inside me, or anything which is ED, right? Now, I have attached follow-up questions to it. Now, one, somebody took the injection to become a bodybuilder, got ED. Maybe a temp ED or a permanent ED. So, second question to it is, somebody who watches porn gets addicted, and the penis is again not responsive enough as it was in his 20s or early 20s altogether. Thinks has a ED because the person has Googled it, of course, thinks he has an ED, right? So help me understand, bust this myth right now, so that people don't really fall into stress, which actually leads to a problem like this.
So basically, there are two type of EDs. One is a psychogenic ED, and another is an organic ED. Psychogenic is basically when you are thinking about it too much. Initially, there may be a performance anxiety. There may be a fear to perform where you haven't performed. You have just, some people feel that if they are not masturbating properly, they may have erectile dysfunction.
Mm-hmm.
So that is itself a myth. Erectile dysfunction is basically your inability to do intercourse which is sufficient and satisfactory to both the partners. So you cannot correlate your masturbation abilities to an actual intercourse. So psychogenic ED is something which we are seeing a lot, and usually with counseling, with lifestyle modifications, we can reverse it. Second is an organic ED, where usually there is something which has gone wrong. Either it is a blood flow issue, where the blood flow to the penis has become less, or there may be a venous leak, or sometimes there may be a neurogenic ED because of the neuralgic dysfunction. So these are something which needs more aggressive treatment in form of medicines, injections, and then we have penile implant surgeries also. When nothing is working, then finally these patients, they go for a penile implant. So for all sort of EDs, treatment is available depending upon how you want to take it. And usually the satisfaction rate is good if the treatment is regular and under supervision.
That brings me to another question. You said lifestyle. Now, right now, a lot of consumption and spending power has increased over a period of, I'll say, 7-8 years. We are the youngest country in the world. Now, when I say youngest country, we have maximum number of people who are eligible for a job and who are in their like early 30s or late 20s. So we become like the youngest country in the world. Now, being the youngest, we become pampered. We get into things which is harmful to our body. We start using substances. Now, substances may include weed, hash, drugs, acid, whatever. It includes whiskey and cigarettes as well. So I've included everything into one category here. Now, I was talking to a friend of mine, and we apparently are pretty good friends, and she happened to tell me that, you know, Ankur, वो एक ऐसे date पे गई थी और ऐसे situation हुई, the guy turned out to be whiskey dick. Now, this whiskey dick is a term which is now loosely used by a lot of people in our age group. What is that? Second, does cigarette also affects the blood stream system? Because you mentioned there are two type of ED issues, right? One which is psychologically and one is which is through lifestyle based. So care to shed some light over there?
See, basically some people, so alcohol can act in two ways. Some people, they lose their inhibition and they can have a good sexual activity. And some people may not have an erection altogether.
Okay.
So it may change. So we have certain patients who are very anxious and they feel that if they are not thinking about it or they are inebriated because of the alcohol, they may perform better. And another category which may not altogether do it. If you are combining alcohol with smoking, usually smoking leads to a decrease in the erection potentials, because what happens is that smoking causes a lot of vasculitis. Vasculitis is something where there is an inflammatory response, inflammation inside the blood vessels. So because the erection is a vascular phenomena where the blood is going in the penis and then the veins are occluding and then your penis becomes hard and then you are able to get a hard on. So smoking leads to a decrease in the blood flow directly to the penis. And early erectile dysfunction is basically a marker of an early heart problem down the line. So if you look at your heart vessels, your coronary arteries, which we say in common parlance, the penile artery is 1/4 the size of the coronary artery, and therefore it blocks early. So that is also important. And that is what I tell my patient, that sometimes we have actually found that when we were diagnosing about ED, and we have seen that there was a cardiac issue also. So basically, your penis is the door to your heart. That's the way simply to put it.
Right. So I have to follow up to it now again. It's becoming interesting for me to know even more. Is ED curable completely?
Yes. So basically, ED depends upon at what point you are coming to us. We have seen patients who have come to us after 20 years. In those cases, the answer would be more of a penile implant. So
What is a penile implant?
So basically, penile implant is a device. So there are two types of penile implants. One is a rigid implant, a semi-rigid implant, which is basically placed in the penis, and then you can have a sex. That penis is in that semi-rigid position because of that implant. The other is an inflatable or a button wala implant. So basically, whenever you want to have sex, you press the button, and then your penis gets inflated.
Okay.
You will still enjoy the entire sexual journey because your ejaculation is maintained. You will have the sensation from your skin. The only thing is, because the blood is not coming, that is being supplemented through that penile implant. And these implants are there for almost 30-40 years. So
wow.
So people never used to know about it. Now, since the spending power, as you said, has increased, and so we are now getting a lot of Indian patients also, and that has saved a lot of marriages. So I have seen a lot of my patients where the first marriage has failed, where the patient did not know about what sexual activity is. On the day of his marriage, he came to know that what sex is, and he was not able to perform. He was divorced, and then when he was remarrying, he got a penile implant. So it is like a disease which can be cured depending upon where it was.
Okay.
So if it is a mild ED, it can be cured 100%. If there is a moderate, we can do that. So there are certain treatments, like there is a low intensity sound wave therapy or a P shot or a Priapus shot, which is given for mild to moderate erectile dysfunction, and it can be reversed. In a severe ED, it can be treated. So basically, the question cure is a wrong statement, because then diabetes cannot be cured or blood pressure cannot be cured. I think it is more of a control. If any disease is not causing me any trouble and I'm not thinking about it, it is not causing any problem in quality of my life, I'm okay. So that's the way to look after it.
How do hormones changes as men age?
So basically, just like there is a female menopause, which everybody knows. So similarly, there is another term known as andropause. Andropause is basically known as adult onset male hypogonadism, basically ADAMS, where your testosterone becomes less and you start getting symptoms like you may feel weakness throughout the day, you may feel that you are forgetting things, you may have bony pain, you may become angry, and these things set up sometimes in their 60s. Now we are seeing them in their 50s also. So basically, the entire disease things are now, so whatever was happening in the 50s, now it's being happening in the 40s. Which was happening in 40s, now happening in 30s. So we have 1/3 of our patients who have erectile dysfunction are less than 30 years. Similarly, andropause, where the testosterone is decreasing, is now in the early 50s. And the symptom which I have told you, these are the symptoms of. So andropause exists. The only difference is that in menopause, there will be absolutely no hormone production, and the female will not be reproductive. In a male andropause, his fertility potential is still there till the late 70s, 80s or 90s. But his testosterone will drop. So it is just the drop of the testosterone hormone.
Dr. Ashish, we spoke about ED, we spoke about lifestyle, everything majorly leads to a lifestyle change only altogether. If you maintain a good lifestyle, I feel is what I've understood, can lead to a better life. And there are a lot of cure to a lot of issues in the world related to your penis. There are two areas I want to speak to you about. One is STDs, which is thanks to dating apps, thanks to people being able to meet a lot of different people from across the globe and music festivals and everything. And the second I want to understand is prostate. So, prostate you can cover later. STDs is one sector which I feel a lot of people must know what it is all about because, like I said, हमारे स्कूल के ज़माने में सीधा एड्स बोलते थे. HIV पॉजिटिव और एड्स ही पता होता था. STD का तो फुल फॉर्म भी नहीं पता होता था. वो इवेंचुअली धीरे धीरे आगे पढ़ाई करते करते एंड समझ में आने लग गया था. सो प्लीज़ एक्सप्लेन. आई एम श्योर आपके पास पेशेंट्स आए होंगे विद issues of STIs or STDs.
Yeah. So basically, STD is a sexually transmitted disease or sexually transmitted infection. And as you said that in common parlance, it was always कि AIDS है या फिर sexually transmitted है तो AIDS हो गया. या अभी भी patient आते हैं कि when they have their first encounter and if the barrier or the condom breaks, if they feel that AIDS तो नहीं हो गया. So basically, STI is something which can be because of bacteria. It can be because of a virus. There are many bacteria which can lead to these problems. The patient may have, and they are curable. So the first thing is that STI क्या क्योर नहीं होगा ऐसा नहीं है. They can easily be cured depending upon आप कब दिखा रहे हैं. Even AIDS or HIV has now become just like diabetes. So you do not die from it. The virus is controlled with the medicines. There are others like herpes. There are other like penile warts. So there are different type of viruses which are there, and usually people make their self-diagnosis just by googling it. But better to seek help. Sometimes it may be just a bacterial infection, a simple fungal infection, rather than a full-blown viral infection or some. So basically, rather than to be your own doctor.
Visit a doctor.
Visit our andrologist who actually knows about it. Sometimes we feel that the people are seeking help from a person who doesn't know about the disease. They may go to their family doctor, and he may give a broad spectrum thing which may not work for you. So STDs are there, and I would say that for anybody, use a protection. That helps a lot.
Dr. Ashish, what you said is right. Let's say somebody's late. Okay. Let's say, I mean, while I was to come and meet you, I did some research and I found out there's a thing called WART, W-A-R-T. And how can, okay, this again I researched. STD, you cannot just get through an intercourse. You can basically get it through oral as well. Is it
Yes.
true? So can you tell us something about how one can get an STD? And let's say somebody who does not like to use condom at all. Can somebody get an STD from a contemporary partner? Or is it only necessary if you have multiple partners, only then you will get an STD? So this is like a very big horizon of the world, and I'm sure you have come across people from various experiences.
So basically, it depends upon that whenever there is a mucosa to mucosa contact.
I'm sorry, can you...
A mucosa means that like if you are kissing, then there is an oral mucosa. When you are having sexual vaginal sex, then there is a vaginal mucosa. So basically, that's the inner lining of our cheek. So if somebody has a sore, if somebody has a oral sore which he or she may not know about it, and if you engage in an oral sexual intercourse, then you may have genital herpes. Herpes usually can be oral or it may be genital, and there may be a cross depending upon the sexual performance, the way it has been done. Sometimes if people are engaging in an anal intercourse also, and if they are not changing, then there may be, that is what makes them more prone to a HIV or an AIDS, or to a UTI or a urinary infection can travel like that. Uh, your second question is that whether you should wear a condom. I think looking at the way people have so many partners, better to wear a protection. Uh, whether circumcision can prevent an STD, uh, it is not 100%, but if you are circumcised and basically since the foreskin is missing, then the mucosal contact which I was talking about is not there, and therefore your chances of getting an HIV infection decreases by almost 70 to 80%. Your chances of getting a herpes infection decreases by almost 90%.
Oh, okay.
So that is, and then you do not have those bacterial or uh, fungal infection in the foreskin in patients who are circumcised.
Okay.
And that's the reason that the WHO and the United Nations are actually circumcising the entire population of Africa, because there the HIV has become endemic. So now everybody is getting circumcised, and that has actually dropped the incidence.
Okay. So we spoke a lot about STDs, STIs, ED, a lot of issues. Been in 21 years of service. Now that you run your own private clinic as well in Delhi, what's your day like? Like, is it like awkward treating male patient? Was it awkward for you to treat a male patient initially when you started practicing andrology?
No. So basically, I wanted to become a urologist right when I started my surgery journey, and urology was the most sought after super specialty. And so we treat everything from kidney stones, prostate to the genitals. So why should I feel awkward about it? I'm rather happy because we are able to serve almost 95 to 99% of our patients. We are able to make them happy.
Do people, let's say someone like me comes to you and wants to show his penis for whatever reason, and do you see the hesitation in them?
Yes, sometimes the first question is that, Doc, can I be frank with you? So whenever this question is, this is the question, I feel that yes, he wants to talk about that. Or sometimes when we feel that there is a boy who's coming with his father and he may ask, the father will say that I am going out and he's going to talk. So I know upfront that he is going to talk about his sexual health. And that's okay.
Maybe somebody's beating around the bush, then what do? He's not coming to the point where the cause of the problem is.
Usually, yes, people do hesitate. But then when we are examining them, they come to the thing that this is also one of the problems. So like we have patients who have prostate problems where they have urinary problems. And then when we are examining their prostate, they may say that, Doctor, I also have the erectile dysfunction. I was not talking because my family was there. So that inhibition is there. But then when you are examining them in close quarters, the inhibition goes and then they open about it.
Okay, fair enough. What is the wildest misconception someone has walked in with?
Very difficult. People may have a lot of misconceptions. One I talked about was that people feel that if they are having masturbation, if the semen, people feel that if they have nocturnal emission, if they have nightfall, then their entire body feels weak next day, my entire protein, and I am getting weak. So that's a big misconception. Your semen does not have protein. It has 70% is water, rest of them have sperms. So if you have nightfall in a young patient, it's normal. It is known as nocturnal emission, and it does not lead to any weakness or any infertility or any erectile dysfunction per se.
Okay, mental health is a major concern nowadays because of work, because of sexual issues. We end up drinking, we end up smoking a lot. Pub culture has blasted throughout the country right now, and we sort of enjoy that as well because it's more like a stress buster for us. कि ऑफिस की भाग दौड़ से निकल के इधर आके दारू पी लेते हैं, चलो ठीक है. सेक्स करने जाते वो हो नहीं पाते क्योंकि दारू इतनी पी ली तो विस्की डिक हो गया, तो बंदे का दिमाग में मिसकंसेप्शन लग से आ जाता है. व्हाट इज दैट वन थिंग दैट यू वुड सजेस्ट or you would advise to anyone, because it leads to a mental health also. आपको सेल्फ कॉन्फिडेंस इशू आ जाता है, आपको मेजरली आपको कॉन्फिडेंस ख़त्म हो जाता है. आपकी गर्लफ्रेंड स्लैश वाइफ स्लैश फियांसे किसी के भी आके, और खुद की नज़रों में भी कि अरे यार क्या कर बैठा मैं टाइप्स.
See, uh, one is what we say is instead of getting high in the night in a pub, you should get high in the morning when you are exercising. So when you exercise early morning, there is something like dopamine, which is secreted. There are endorphins which are secreted, and they once you get the hang of it, like if you are running, if you are cycling, or you are doing any sports activity in the morning, not in the evening. Some people go to gym in the evening, which I feel is counterintuitive because your body circadian rhythm in the evening is now it is saying that you need to sleep. At that time you are revving up your engine by going to the gym by so basically now what you have done is that you have revved up it so much that you will not have a proper sleep. So a proper sleep, a very good daily routine in the morning where you are exercising for 45 minutes, 1 hour maximum, 5 days in a week, and a balanced meal. You can have cheat days once or twice in 15 days or maybe once a week. But then if you are giving 1 hour to your body and then taking a proper diet and nutrition, that is going to have a long lasting effect. Once you get the hang of addiction of exercise, because now the most important drug to longevity, now there is a recent article from New England Journal of Medicine where they found that exercise is the drug to longevity. So that is it. If you exercise, even if you are drinking and smoking, you are going to live longer than a person who is not drinking and not exercising.
Okay.
So the factor is basically a good physical activity.
Viagra. So again, this is all personal research I've been doing. So I met about 30, 40 odd chemist people across Delhi and the current city, Bangalore, where I'm residing now. The increase of Viagra has increased apparently, is what they say. And what I know after I did my research, Viagra was actually a medicine which was being invented for a different purpose and solved a different purpose altogether. Yeah. So what do you suggest for a younger youth and anyone who wants to be young at an old age taking a Viagra? Because there have been cases, after taking Viagra, somebody is like dying.
So basically, there's a very interesting story about how Viagra was invented. And basically, now Pfizer has sold it to some another company. So Viagra was actually a drug for treating pulmonary hypertension, and that when the drug was given to the patient, they were so happy with the drug that they never wanted to come off the trial. And then when they were asked that why they don't want to stop the trial and they want to be a part of the study, they said that their erections are, and then the Pfizer hit the jackpot. So Viagra was actually tested in patients who had a cardiac morbidity, who were cardiac patients. The problem is that Viagra off the shelf has a lot of impurities. The second is the proper dosages of the Viagra. The third is whether I need it or not. Usually 70% of the time it is being used where it may not be needed. There is a peer pressure where the friend may say that you can use it here, you are going for the first time, you will have good performance. So ultimately then you depend. So any drug after a certain point of time will stop losing the effect. So therefore it stop losing the effect, and it can be taken but under medical supervision. As I have told you that there are many erectile dysfunction patients who have a underlying cardiac issue. If that issue is not there, then it can be taken safely, but not over-the-counter drug.
Okay. Well, I think this is good insight for people who use it as a party pill altogether. सर अब करेंगे अब एक लास्ट है फ्यूचर ऑफ मेंस हेल्थ और फिर क्विक फायर मारेंगे फिर क्लोज कर देंगे. ठीक है. सो okay, so what is the futuristic treatment in andrology? I mean, one you mentioned, which was doing a pineal implant.
Yeah, so basically there are a lot of, I think regenerative medicine is going to come up, and there are a lot of research into that. Stem cell therapies may come up in the future, and we have a lot of AIs into penile implants. There may be heat malleable implants also. So there are a lot of research being going on in this, and I think the future is bright.
So, Will, you mentioned AI. Now, AI is a term which is now used by everyone. Although it has been there in our life for a very long time, but it is now loosely used by everyone. I'm not saying you, but AI is there in healthcare, right? And you mentioned that AI is going to change in future into men's health altogether. How do you think it's going to affect men's health in this particular sector altogether?
See, basically, now what is happening that there are a lot of research which has been fed to the AI. So basically, it's all about like garbage in, garbage out. So depend if you feed the correct data, then the outcome is good. So there have been a lot of studies, especially in infertility, where what protocols need to be done and what has worked for an infertile couple, what hasn't worked for them, that is fed, and then protocols are now being generated. So I think AI as a tool is going to help us. So it is not going to replace the humans or the doctors, but it is going to help them to diagnose it properly and then to treat it according to evidence.
Okay, Dr. Saab, एक rapid fire round आपके साथ. One thing every man should check once a year.
So they should have their prostate examination, especially a blood test of PSA after age of 50 years.
Biggest lie you've ever heard about penis health.
I'll pass this.
अच्छा ऑफ रिकॉर्ड तो बता दो. Okay. What is the hack for a sperm count?
A good amount of fluid in the body, proper hydration, decrease milk products, decrease estrogens is in form of soyas, and quit smoking and alcohol.
What's not normal when you pee?
If you are taking a lot of time to start, there is a hesitancy, there is an intermittent stream, if you feel there is a frequency or an urgency to pass urine, if you feel that the urine is you haven't voided completely, if you are getting up more than twice in the night to pee. So these are all symptoms which are not normal.
Pee shyness, is it real or psychological?
Pee shyness is real. We have seen a lot of young boys who hold their urine, especially I've seen it in females where they do not have an access to a toilet, and they are then holding that urine for a long time, and that leads to dysfunctional voiding.
Dr. Ashish, thank you so much. And towards the end, I would like to, convey my gratitude to be part of the podcast and have the discussion with me here. This has been an eye-opening, not just for me, for people in the room and for the viewers as well, because of which we are shooting this podcast. एक जो शर्म रहती है किसी इंसान के अंदर, किसी एक लड़के के अंदर में एक डॉक्टर के पास आने से पहले वो 50 बार सोचता है, वो मेरे हिसाब से कि अब वो इस बारे में नहीं सोचेगा, वो डायरेक्ट डॉक्टर के पास आएगा और बात करेगा. एंड आई थिंक दिस इज़ द मेन मोटिव टू रिमूव द टैबू in the country right now, and people can talk about it while just coming to a doctor. I have this one very important question for you, Dr. Ashish, which is, what is that one thing that you would like to change in the society in this current age about men's health? What would it be?
I think we have a lot of distance to cover where people are talking about their men's health, especially the young boys. When we were very scared of our father. Now what I feel is that that gap may be decreasing, and so for parents I will say that once your children are hitting puberty, you can talk about them. You can talk about how they're basically whether they are getting morning erections or not. Sometimes an early ED can be detected by a loss of morning erection, especially in a young boy who is just hitting puberty. How their urinary stream is. Are they getting up in the night to pass urine? Is there any bedwetting? So these things I think parents can talk about. And maybe we are practicing in South Delhi. We are getting those patients, but in areas which are not maybe tier 2 or tier 3 cities, there may be still inhibition. And I think this podcast of yours will help to reach that audience, and they can also talk about their sexual health and their other symptoms about their reproductive organ.
Well, Dr. Ashish, thank you for that. What is that one thing a men should stop being ashamed of?
See, basically, what I have found is that people have lot of concern about their penis size. And I feel that if you get a counseling, you should know what the proper size is, which we have talked about. What is the duration, which we have talked about in the episode. And usually everything is in your head rather than in the organ. So if you clear your head, your organ is going to perform well. And whenever you feel that there is an issue, we are there to help you out.
Do boxers versus brief, like what do you suggest? Like, does it make any difference if you wear briefs or boxers?
See, the study was there, but the evidence was not there. So basically, it doesn't make a difference.
Okay.
And if people are going for gym where they are lifting heavy, then yes, a brief, or I would say a caudal supporter or a jock strap is something which should be used. And for people who have, so this is basically not everybody. If you feel that you are comfortable in a boxer, you wear a boxer. If you feel some people are comfortable in a brief, they can. It doesn't matter. It doesn't lead to any infertility per se. That's a myth.
Dr. Ashish, since you have come with a lot of experience, I'm sure you have a lot of case studies to tell us about. I mean, you avoided a question where somebody walks in with a misconception or somebody asked you a very weird question. I understand that. But I'm sure you can talk about some of your very impactful case studies in your career of 21 years.
So, there are many. One was actually of a doctor. He has an issue. He had a problem in passing urine. He was himself a radiologist who can actually diagnose what is going wrong. But because of his routine and whatever routines we doctors say, blah, blah, he was not able to take treatment. And when we treated him, we did a laser operation on his prostate area. He voided, which he has never voided in his life. So almost 23 years, he was facing this problem, right from his pubertal age till the time he completed it, super specialist, and then he became. So basically, that is something where you can make a life-changing thing. The second would be I was talking about. We mentioned that there was a boy who was a gold medalist, and he came to me when he had an erectile dysfunction. He was divorced because of the erectile dysfunction, and then we did a penile implant surgery when he was for a remarriage, and he came with his wife, with his son. So that is something where actually people can have a change in their way of life. One right treatment can actually change the way they look forward towards their life. There was one female patient who came with, so basically we were talking about the male dysfunction. There are many females who have problem in urination. They have painful voiding, and they are scared to even go to the bathroom because of the sensation of pain. And we were able to diagnose properly that there's a condition known as interstitial cystitis, which is known as a painful bladder syndrome. And she was a professor herself, teaching student, and she said that it's very difficult to even take the lecture. Now, after the procedure, after the surgery, she has an active life. She is able to enjoy. She is able to go to cinemas without breaks. And this is what I feel, that if you have a meaningful impact on the quality of life of a person, is something which I feel that makes what we are and makes our life also meaningful.
डॉक्टर साहब, बहुत बहुत शुक्रिया आपका सीसूर क्लब में आने के लिए. आपसे बात करके काफ़ी ज़्यादा मेरे भी मिथ्स खुल गए, और आई एम श्योर हमारे व्यूअर्स के भी काफ़ी खुल जाएंगे. एंड आई एम श्योर पीपल वुड टेक दिस very seriously this podcast, this conversation that we had, and they do reflect upon themselves and they make changes in their lifestyle. But in case if anybody who's out there, wherever you are, if you have any issue related to your sexual health, which is leading to your mental distress as well, please walk up to a doctor. You can visit Dr. Ashish Saini. He's based out of Delhi in GK1. And you can definitely have a phone call conversation with him as well. And be open, be open to talk about it. Don't worry about it. Everything is curable in this world. And and the doctors are there to help you out. So just go out there and talk and don't worry about much. And don't take too much stress. Jai Hind, everyone.
Thank you.